at the beginning of July, and so there is sustained transmission everywhere locally. And so I think it's really important to get vaccinated. If you're on the fence, I know there's a group that just never will, but I hope that somebody listens today and thinks about it long and hard and how protective it is.
I'm going to talk about ask you about the Delta virus in particular after our come back from our second break. But as far as we're waiting on the FDA approval for the vaccination, do you see minds being changed at that point? Because I do hear some people saying, "Hey,
so yeah." And the thing that I had so many people ask why has taken so long. So the companies that made the vaccine submitted all their data to the FDA in May, and typically FDA approval takes 6 months. So we're certainly well within a 6-month period. So it's really not taking a long time. But we haven't had a situation where we needed really to rush things like we do now. I've heard that Pfizer may be approved as early as next month, or any day now. But I'm hearing early September. I do think that'll change a lot of people's minds, I hope. I think that the Novavax vaccine might change other people's minds too, because it is made with a traditional flu shot protein method. It's made exactly like a flu shot. And I think that'll make some people feel comfortable that have gotten flu shots and know it's the same technology. We're expecting that one maybe, hopefully, late September, early October. But, I'm not 100% sure on any of those numbers. Sometimes they just come out and we hear about them a couple days before and know they're coming that soon.
The flu vaccine, it's something that people take every year. It's not like the polio shot or smallpox or something. It's something we typically take every year. We're offered every year. Do you see that being the same for the future of any of the COVID vaccinations?
I think we'll see that until we see it go away. Last year I thought this was going to behave like other coronaviruses, which don't typically circulate all the time like flu does. I've been surprised that I was wrong. I thought that COVID would probably die out because that's typically what other coronaviruses have done. If you look at MERS and SARS and things like that, they go away. But this one has not. So I really, if we don't get a handle on vaccination and sustained transmission worldwide, because, the World Health Organization was saying the other day, it's a world problem. That's why flu comes back every season, because it goes to other parts of the world during, our summer is their winter and that type of thing. So if COVID continues to be transmitted worldwide, we'll see this yearly.
Dr. Laura Larson is our guest on this morning's Community Voice program, Medical Director of Infection Prevention for Tanner Health System, also Chairperson of the Carroll County Board of Health. Time right now is 8:42. We'll take our first break, come back and continue our conversation. Again, if you have questions, I encourage you to post them to the News Talk 1330 WLBB Facebook page, and I will take a look for some of those right now. We'll come back with more with Dr. Larson after this.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. Our pre-K 3 through 12th grade environment offers a family-oriented atmosphere. We are an independent school with faith-based values and an Academy Honor Code. Our academic standards prepare our students for college and beyond. I'm Patrick Duran, Headmaster, inviting you to visit us on the mountain or at oakmountain.us. Come see how our warriors are creating legacies.
8:43, and welcome back to the WLBB Community Voice here on News Talk 1330 FM 106.3, streaming live online, newstalk1330.com. And this morning we are on the News Talk 1330 Facebook page. I'm your host, Colin Worthington. Our guest is Dr. Laura Larson, Medical Director of Infection Prevention for Tanner Health System. Go into our Facebook page to look for some questions and comments. Let's see here. Jay Gill. Dr. Larson, thank you for your work on this. Are local hospitals utilizing treatments like ivermectin and hydrochloroquine? I've also heard a lot of debate about those. Also, if someone has long and short-term antibodies from infection, are they better protected than a vaccine?
So we are not using ivermectin or hydroxychloroquine on inpatients. I know that some providers are doing this as an outpatient. Officially, the recommendations from both the NIH and the Infectious Diseases Society of America recommends only using those agents in the context of a clinical trial because efficacy has not been established. We do know that in inpatients, Decadron is extremely has been shown in multiple studies to be effective. So we are using steroid therapy. We are still using remdesivir therapy. We're still not convinced that has. It actually works very well if patients are caught early. If it's been 7 to 10 days into infection, it's not as effective. We're also using a monoclonal IL-6 inhibitor antibody in the hospital, which is called Actemra. And that is something that's been newly recommended, studied a lot last year, but that's recommended for patients that are severely ill or progressing. For outpatients, we are treating people that are at high risk to progression to severe disease with another monoclonal antibody. The one that we're using now is called Regencov or by Regeneron. That was the one I think President Trump received last year. And the reason those monoclonal antibodies keep changing for what we give is because of the what is working against the predominant strain at the time. Some of the things that we used previously, like bamlanivimab, are not as effective against the Delta variant. So at this point, we're using Regencov. For short-term antibody versus long-term antibody, as far as I know, there are no head-to-head studies that show that having your own antibody is effective at preventing illness. I do know that some of my more fragile patients that have been infected have gotten reinfected. I have one patient now that has been infected. It's her third case of COVID in the last year and a half. So her antibodies are clearly not protective for her, even though, when she has been admitted, when we check her antibody status, it's positive, but she has COVID. And this is an independent case of COVID. We consider an independent case of COVID when it's been greater than 90 days after the positive PCR test and consistent symptoms. So I can't really say. I have one patient who was terribly ill with COVID last year, and I didn't know what to do because his antibody status is negative, but I counseled him to go ahead and get vaccinated because my fear is that being so sick from COVID, if he got it again, he would not survive. So that's the thing is we don't really know how protective prior infections are. We do know as a generalization that if you had a really mild illness previously, you may not be protected. And we know from the beginning of all of the antibody studies that up to 30% of people that get infected do not have neutralizing or protective antibodies. So up to almost a third of people that have been infected are potentially able to be reinfected. So it's hard to know. I wish I could have a more definitive answer for that.
Well, let's talk about the Delta strain a little bit. Why is that seem to be more transmissible?
There's no real way to know why. We just know that it is. And it's the predominant strain in the United States right now. We know it's more contagious it's estimated to be twice as contagious to others. And it may cause more severe illness than previous strains in unvaccinated persons. And we're seeing breakthrough of the Delta variant in people that have been previously vaccinated. So, previously when I was in a group of vaccinated people, I felt really comfortable about not wearing a mask and, socializing and that type of thing. And then we started seeing breakthrough cases, albeit most of these are mild, but it kind of means that we have to do, another layer of protection against that particular variant.
All right, time right now is 8:49. Our guest this morning is Dr. Laura Larson, Medical Director of Infection Prevention for Tanner Health System. We're hearing a lot about the viral load, which is supposedly does come with the Delta variant, and I guess asymptomatic individuals with that and transferring it to other people. Mm-hmm. I mean, even people who've had the vaccination. I guess to better understand it, is it just lodging in our nose? It's closer to escaping our bodies into another one?
They haven't really worked that out yet. It's just like some bacteria are just more pathogenic, and this virus is just more pathogenic. And it's estimated to lower the vaccine effectiveness. If you're talking about the mRNA vaccines, that are usually about 95% effective, it lowers their vaccination effectiveness to about 88%. So they haven't really worked out the mechanism per se of what is different about it. They just know what the mutations are. And it's just obviously it's probably just a better fit for getting into our cells. We know that with HIV. There's some HIV viruses that are better at getting into some people than others. And that's probably the very same, that the Delta virus just is a better key for opening the door to our cells.
All right, before we take our final break here, Amy Berryman Lackey on Facebook said someone who's had COVID twice, just got a vaccine, is now having severe symptoms again. How long will that last, and is that common?
It is more common to have symptoms after vaccination when you've had COVID before, but it typically lasts less than a week. And then it also, it's one of those things that I've had one of my colleagues that had severe COVID last year had a terrible reaction to the first one and then didn't have a strong reaction to the second one. There's really, our immune system is so variable, and there's no rhyme or reason to it. So unfortunately, when you get a booster, your immune system will recognize it as something it's seen before and work on it, and that can cause you to have some symptoms, but it should last less than a week.
All right. Denise Steele says, is it safe to have surgery right now? I guess, certain surgeries may not be extremely necessary at a given point. Has Tanner considered removing those again?
We haven't, and we've actually upped our preoperative testing policy, and so we have not had to stop surgeries yet. Typically, the hospitals that are having to do it don't have enough manpower to take care of the patients they have, and that's why they have to stop surgery. So far, right now, we're in a good place of being able to take care of our inpatients and take care of our surgical patients.
Okay, we'll take our final break right now. Come back with about 7 minutes, and I believe we'll talk about masks. I'm sure we can talk about that entire 7 minutes. Community Voice brought to you by Tanner Health System, Oak Mountain Academy on News Talk 1330 FM 106.3.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
As a graduate of Oak Mountain Academy, I found that my experience on the mountain prepared me beyond all expectations. As a junior at Auburn University, I approached my studies with great confidence thanks to what I learned at OMA. When I think back on my time on the mountain, I think of my teachers. Their genuine love and concern for me as a student was always evident, and now, as an adult, I still foster those relationships. I'm Carly Robinson, an Oak Mountain Academy alum. Visit oakmountain.us to see how you can offer your child an amazing opportunity to be a warrior.
All right, 8:53. The WLBB Community Voice, News Talk 1330 FM 106.3, also streaming live online at newstalk1330.com and the News Talk 1330 WLBB Facebook page. I'm Colin Worthington. Our guest this morning, Dr. Laura Larson, Medical Director of Infection Prevention for Tanner Health System and Chairperson of the Carroll County Board of Health. Doc, what are still some concerns that you're hearing from people, and I guess what is your response to people over masks, regarding masks? Why? What are the biggest concerns you're hearing from people who don't want to wear them?
I think people just are under the impression that they don't work. And, my answer for a lot of people will be, well, would you want your surgeon in the OR not to wear a mask? And, I was really surprised about the debate over masking, because that has been a tenet of surgical care for our patients for over 100 years. So we do know that they do prevent the spread of disease. They're more protective of others than yourself. So when, you're wearing a mask, I still wear my mask in public places now where I can't socially distance. It makes me sad when I see other people not doing the same, because the science is that it's protective if both people wear them. So that is a lot of it. I think there was also a lot of back and forth information about masking early in the pandemic, which I wish that had been more transparent about why we were asking the public not to mask. It was not because it didn't work. It was because we didn't have enough masks for healthcare workers. So that back and forth information and changing information has been made people very wary, and I get that. I mean, I think that's very important, but I really think that because of the Delta variant not being as protective as it's being more contagious and the vaccines are not as effective for it. I mean, granted, we're talking about 5% less or 7% less, but if you want to prevent a breakthrough case, you still have to add that other layer of protection.
What kind of masks do you recommend? Are there masks that you don't think work as well, the quality, material?
The cloth masks don't work as well as a 2-ply surgical mask or a 3-ply surgical mask, and those are readily available now. So I prefer, a 2-ply surgical mask. If I am in a situation seeing a patient, obviously, that I think has COVID, I'm wearing an N95 and eye protection. So, it's one of those situations that if I had a family taking care of a family member at home that has COVID, you would want to try to get the family, the caregivers, wearing N95s and eye protection rather than just a regular mask if possible. Sometimes, I've learned this over this last year, people can't always distance in their homes. It's just not possible. So giving them the tools of the more effective masks are helpful here.
As far as wearing the mask, a time frame do you recommend that you change your mask every day? Can you wear it for an hour and then you need to take a break? Are we concerned about bacteria or carbon dioxide?
I would definitely. No, carbon dioxide never bore out. And we have surgeons that do 14-hour surgeries and they don't pass out in the in the OR suite. So that's not really a real concern. It was a concern a lot of people brought up, but I change my mask daily. Obviously before we had the pandemic, we changed it with every patient. I think that you're safe changing it daily. I wouldn't wear them for a long time because they do, if they get a lot of moisture, they're not effective. So if you get your mask is wet or moist, you need to throw it out. So at least daily for me. If I'm sweaty and I have moisture in my mask, I want to go ahead and get a new one. Obviously, if it's soiled with anything, you would want to change that out too. But, it's just, it's one of those things that's just a nice layer of protection. I do want to mention a couple of things, if that's okay.
Yeah, sure.
Everybody, including other healthcare providers, asked me where to get a vaccine. We have a couple of different options for finding vaccines. Tanner has a site called tanner.org/take my shot. It leads you to a really nice link called vaccines.gov, and you can pick, where is the Johnson & Johnson vaccine, where is the Pfizer vaccine, where is the Moderna vaccine, and find a vaccine. And then later this month, we're doing a physician panel and several local educators with cardiology, pulmonology, OBGYN, GI, pediatrics, and family practice. This has really been spearheaded by Dr. Charlie Rouse and Thelma Wadley-Lucas, and we're going to talk in a panel discussion about facts about COVID-19 and vaccination. It's Wednesday, August 18th at 7 p.m., and you can register at tanner.org/vaccine facts. These are really great forums because, you have an OBGYN talking to you about fertility issues. You have cardiologists talking about all the cardiac effects of COVID. So, if you're, again, nervous and on the fence, please sign up and listen to us because we're here working with these patients right now.
As chairman of the Carroll County Board of Health, did our local school systems seek advice from you?
Yes, they did.
And what did you tell them as far as masks?
That both the Department of Public Health and CDC recommends masking when social distancing cannot be when you cannot socially distance. Mm-hmm. So I know that all the systems reached out to us, Carroll County and Carroll City, Oak Mountain Academy. So we were contacted by all.
Well, it seems that only one followed the local advice, though, because all of the districts, the systems seem to be referring to the CDC as their guidance. But, I would feel that it would be more important localized. It's a localized issue because the numbers aren't the same everywhere.
Right. And our percent positivity, it's recommended, Georgia's in the red for the states with high transmissibility because our percentage of positive testing is over 10%. It's not only over 10%, it's 25% right now. So it's just not unfortunately, it's not a very popular thing to do. People feel like children don't get sick and don't get COVID. They do get sick. And we had a child, 17-year-old from Douglas County that died within the last month. I know those events are rare, but children do spread disease to families. So I feel strongly about masking. And
the last thing we have time to say, that the number of children getting COVID is increasing with this variant, latest variant.
It is. We're seeing that in our testing. We had 20 children alone, less than 18 that test positive yesterday. So, and our overall number of tests positive yesterday were, let me get that number, I think we had 60-something tests positive, so a third of ours were children then. I mean, that's a lot. Yesterday was a big day for children. The day before was 5.
All right. Dr. Larson, thank you very much, and thank you for listening to this morning's program. I'm sure if you have any other questions, if we missed anything, please post it on the Facebook page, and Dr. Larson or somebody from Tanner may be able to look at that and answer it for you. Time right now is 8:59. Stay tuned for national headlines, followed by your local news here on News Talk 1330 FM 106.3.